Kwa majina ninaitwa Ruth Mandela. Mimi ni mkaaji wa Nakuru. Ninaamka 5:30 asubuhi. Ninaosha vyombo, ninaekelea chai. Chai kifa, sasa ninaamsha mtoto, nampanguza vizuri, namfaisha. Kisha anakunywa, na ingine nampakia, na mwacha anatulia kidogo wakati amekunywa. Ndio sasa ninamwamsha, tunatoka naye.
For the Grow East Africa project, we are currently looking at the nexus between childcare service provision and women's economic empowerment. This project is being carried out in Nakuru County, and we are evaluating the Kidogo model to see how improvement in the quality of childcare service provision can result in women's economic empowerment.
Namfikisha kwa mwalimu, namwacha kwa mikono ya mwalimu, ndio mimi natoka nakuja kazini.
One of the projects under the Early Childhood Development Unit at the center is the Growth and Economic Opportunities for Women, which we call the Grow East Africa project. So APHRC has been implementing this project in Nakuru County, specifically Nakuru West Sub-County, since 2021 August. So it's been ongoing for the past 2 years. So this project seeks to evaluate the effectiveness of the Kidogo model in enabling women to improve their economic empowerment outcomes.
Kidogo is a social enterprise that works in informal settlements of Kenya to provide quality childcare. Our key vision is to make sure that all children, regardless of where they are born, they gain access to quality and affordable early childhood care and education.
Wazazi wanatafuta pale pa kuacha watoto ndio waende kazini. So setup ya daycare ilikuwa inalazimu. Kwa maana hawa watoto wadogo wanalelewa kwa under daycare, not under class. So ilibidi to set up a daycare ndio tuwezeshe hawa wazazi waende kupata riziki kule nje, na pia sisi vile vile tuweze kupata riziki.
Nilichagua Childcare Kids kwa sababu kuna jirani alipeleka mtoto huko. Nikaona vile wanamlea vizuri. Hiyo wakati sikuwa na job. Venye nilipata job, nikaamua kumpeleka mtoto wangu kwa hiyo daycare.
Kidogo when they came, hatukuwa tunajua malezi ya watoto, but tulikuwa tunajua malezi ya mafunzo, kufundisha watoto, lakini si kulea watoto.
Chamos, habari ya leo?
Niko mzima.
Tumekuletea materials.
Ndio.
At least uongeze kwa learning centers.
Yes.
So that watoto waendelee kucheza nazo.
Karibu huku kwetu.
Asante sana.
Ndio. So wakati walikuja wakatu equip na mafunzo ya kulea watoto, which means tukapata skills za kulea watoto, wakatu equip na materials za watoto, wakatupea mattresses. Kidogo ametusaidia a lot.
Huwa na travel mguu. Nikitravel mguu nafika hapa 8:30. Napata mkubwa wangu amefika, tunaanza kusaidiana kufagia, kupanguza meza, kujitayarisha, kisha yanaingia jikoni kuwasha moto na mimi naanza kuosha vyombo, na siku inaendelea.
Kwa kazi yake si mbaya, sababu hata ikiwa mtoto hasikii vizuri, ananiambiaga tu asubuhi, na leo utanifungua mapema, nitaenda kuangalia mtoto, lakini ananiambia amemuacha kwa shule yenye anaangaliliwa vizuri, hata kuwa na pressure sana. Maybe simu hata akipiga ni mara moja ama mara mbili.
The children's outcomes are optimal in terms of the way that their cognitive development or language development is enhanced through the stimulation that they receive in the early years.
We teach them even the life skills, to know how to go for toilet and then hand washing.
The daycares can be able to provide an opportunity for the children who are going to these daycares to at least be able to be kids and to be children.
Some of the challenges that we faced in this work is that we were working in daycares that had an intervention and daycares that did not have an intervention. So for us, that was a challenge because children who are in daycares that do not have an intervention did not really get the benefit of that the children in daycare centers that had intervention had. So it is important for researchers to invest more in such kind of settings, because when researchers come, they're able to highlight these challenges. And when we get these findings, we can share them with policymakers, and we can be able to bring interventions that can improve the lives of these children.
It is very important for women to invest in this business of daycare because it's very fundamental for them. First of all, it creates employment for them, which has not been the case earlier on, whereby most of them were just stay-at-home moms. But now being able to be trained by Kidogo, they are able to open up their own daycares and they're able to earn a living from it.
And if these women are given an opportunity to go out into the labor market and participate in paid work, it will improve outcomes first at the household level, secondly at the community level, and overall at the society level.
In regards to policy interactions that we are having here in Nakuru County, we are engaging with policymakers through the technical working group that is consisting of county officials. Our job is to have these conversations that will seek to better the quality of care being provided for children under the age of 3 here in Nakuru County.
The mother is always very central to the performance of an economy. And what we're looking at is Nakuru County, when we talk about daycare centers, we are looking at a position where we should be able to grant these mothers who are working on doing something to build the economy and provide for their families some little bit of leeway to be able to get something to feed themselves.
In Nakuru West, there is a big impact, whereby because most of the mothers have brought these children in these facilities, now we are able as healthcare workers to reach these children in a simpler way. We go there, we do health education to the caretakers. We also ensure that these children are fully immunized by taking their books, their mother-baby booklets. We also give holistic health education to these caregivers, whereby in case there is any challenge among these children, we pick it up and we do referral to our nearest health facilities.
Ile kitu nilipendelea hiyo daycare, nilimpeleka huko mara ya kwanza, daktari akaingia, kaangalia mtoto na akaambia mwalimu, inafaa nipatane na huyu mzazi wa huyu mtoto nimuulize mawili matatu, na wakati tulipatana naye nikamwelezea venye hali ya mtoto ilikuwa. Huyo daktari akaamua kunisaidia, kamletea mtoto supplement, nikaendelea kupea mtoto supplement kushirikiana na mwalimu hadi mtoto wangu akaimprove.
Na katika hali ya kupokea watoto tunafanya temperature. Lazima tuangalie vipimo vya hali, tunaangalia hali yao iko aje. Kama kuna dawa, tunapokea dawa, tunajua anapewa dawa saa ngapi. So from there tunaanza na free choice. Free choice, hali ya kuimbisha watoto, poems, nini, vitu kama hiyo. Then tunaenda kwa small group activities. Wanafanya vitu zao wakiwa kwa small group activities, maybe coloring.
Ninalipa 100 kwa kila siku, na inakava matumishi ya kumpaia tissue au ndio upai. Machumu nini fruits zenye mtoto anakula, hao ndio wapaia. Lunch hao ndio wapa, na chai ya saa 10 hao ndio wapa.
Mamapreneurs are important because they lead to greater and better outcomes among themselves in terms of their own economic empowerment, and better outcomes among children because they are the ones who spend a lot of time with the children in the childcare facilities.
Children who go through daycare are well prepared for the next level in education. So it is like a stepping stone, a stepping, ground to nurture these children before they go to PP1. So when they go to PP1, teachers who handle them, now they are in our hands as ECD. You realize that these children are better placed cognitively, socially, and even emotionally to handle the ECD now curriculum design. You are not going to start from zero. They are at another level.
It is important for a lot of work to be done so that the quality of childcare centers in these informal settlements can be improved, for these women to be able to do their work in peace, knowing that their children are being well taken care of in childcare centers that are of high quality.
One of the outcomes I would like to see through this project, which I would consider a win for us, is having the childcare facilities bills that many counties have ratified into acts. Having an act in place would mean that these counties would then consider a budgetary allocation for the childcare sector, And the Act would also provide a regulatory framework within which the childcare facilities would operate.
We are now in the process of formalizing the partnership. We are initiating the process of partnering with Kidogo to ensure that the regulation, they support us on the coming up with the regulation. On county regulation, it needs to be subjected to public participation, to be accepted by the members of the public for implementation.
The African Population and Health Research Center has been able to achieve a lot through this project. Our greatest win is the buy-in by policymakers and stakeholders here in Nakuru County. We were also able to establish the Center of Excellence. Through this institution, people who would like to set up a daycare here in Nakuru County or elsewhere in the country will be able to come here and learn from the people who are executing this project, and they'll be able to transfer the knowledge that they gather here to their various locations.
Ninafurahia na hiyo daycare kwa sababu inanipea muda mzuri, ninafanya kazi vizuri ili kuwatafutia chakula.
I'm looking forward to a time when we celebrate with the Kidogo team in the whole of Nakuru County that they have made an impact in terms of taking care of our children as from 0 to 3 years old. So Kidogo, keep it up. Your work is good. You're on the right track. And we are here to support you as one of your stakeholders in the education system of Nakuru County.
Taking care of vulnerable mothers is not just my role, but also my passion.
I'm a champion for women economic empowerment through increasing access to quality childcare for women to pursue employment.
Women are not just mothers, they have a lot more to offer.
Investing in women is investing in society. Investing in children is investing in our future.
I am a champion of women economic empowerment, and I do this by ensuring that the children of Nakuru County are properly taken care of. Cheers.